Good evening, everyone. My name is Neil Scott, and for the past 18 years, I have been the producer and host of Recovery Coast to Coast Radio on iHeartRadio. We've now upgraded to a national podcast, and you can find all of our programs at recoverycoasttocoast.org. You know, the bright side of addiction and the bright side of mental illness is recovery. And recovery is living proof. And that's what we're all about here tonight. We must continue to shorten the distance between active addiction and mental illness and long-term recovery. It can happen, it will happen, it continues to happen. I'd like to welcome everyone tonight. It's so great to finally be back in an in-person environment. I've been fortunate enough to be the MC quite a few years now, and of course we got sidetracked by COVID and Zoom and all of that, but we are here in person tonight. We welcome everyone, legislators and elected leaders, special guests, and of course community members to this in-person annual celebration of our community's commitment to behavioral health care and recovery. Now, before we meet our legislators on stage, we'd like to acknowledge and to thank the many co-sponsors of this year's forum. And at last count, I think there were 41. This includes provider agencies, health plans, advocacy organizations, and many other community partners. Thank you to the co-sponsors. Would you please give them a round of applause? They put this thing together. We would also like to welcome the many other elected officials, including judges and city and town mayors, and dogs, of course, and members from all across King County who have joined us tonight in the audience. We thank you to all elected officials here this evening. So let's get this thing started by welcoming a dear friend and a staunch advocate for individuals and families who struggle with mental illness and addiction. He's a fourth-generation Washingtonian. He served the region for more than 2 decades as a state representative, a state senator, King County council member, and for the last 14 years, he's been our county executive. And by the way, I just found this out the other day. King County is the 12th largest county in the country with over 2.3 million residents. Wow. He's championed efforts around housing, childcare, climate change, and public transportation. And most recently, our King County executive has led efforts to bolster the behavioral health system and create a connected continuum of care in the region. He's also an outspoken champion for people in recovery from mental illness and addiction. Ladies and gentlemen, please join me in welcoming to the stage our good friend, King County Executive Dow Constantine.
Good evening and welcome to King County's annual Behavioral Health Legislative Forum. For more than 2 decades, this community has joined together for this event, shining a spotlight on effective, accessible behavioral health care and celebrating stories of recovery. Tonight, you will hear about the progress we've made and the work ahead. In 2023, the community raised significant awareness of behavioral health needs and took decisive action to address those needs. I want to start off by highlighting 2 major steps King County is taking. The first is our Crisis Care Centers initiative. I'm grateful to the King County Council and voters for approving the Crisis Care Centers levy. Over the next 9 years, the initiative will restore mental health residential beds, invest in our workforce, and build 5 crisis care centers, including 1 dedicated to youth. Together, we will build a comprehensive crisis response network, including a robust and representative workforce, because people are at the center of the Crisis Care Centers initiative and critical to its success. However, after watching numerous facility and program closures and too many providers struggling to hire and retain experienced and representative staff, we know it will take more to bolster this essential workforce. That's why we took a second major step this last summer. In partnership with the region's 5 managed care organizations, I announced an investment of $30 million in the community behavioral health providers of the King County Integrated Care Network. This funding created a 15% increase in Medicaid rates, a down payment on the state's similar investments coming next year, and helped stabilize provider operations and increase worker wages. This progress can only be sustained with the state's foundational behavioral health investments, and I'm deeply grateful for the state legislators in our county. Those here tonight championed historic investments in behavioral health care over the last 2 sessions. This is a significant step in the right direction. Thank you for your leadership. But the work is far from done. Deeper state investments and policy changes are needed. In 2024, the county will ask the legislature to strengthen Medicaid funding and other workforce supports for community behavioral health care providers, build and preserve community behavioral health facilities, fully fund state crisis care programs, expand community-based programs for people with the most intensive behavioral health needs, including those that help people avoid the criminal legal system, and strengthen life-saving treatment for individuals with substance use disorder. The county and state must continue to partner closely to expand accessible quality behavioral health care for our region until the pathway to recovery is available to all. Tonight, you're going to hear a few stories that will demonstrate what's possible with the journey of courage and healing, leading more people to recovery. Thank you again for your continued partnership and collaboration, and everything you do working on behalf of the people of King County.
We have a great friend in Dow Constantine, that's for sure. Joining us tonight are 2 speakers from Seattle Public Schools Interagency Recovery Academy. Student and family advocate Seth Welch and a wonderful student, Karis Paul. They're going to come up and share with you right now.
My name is Seth Welch. I am a person in long-term recovery, and I'm honored to be here tonight and to get to share with you about a solution that I can absolutely stand behind with total integrity and say is completely working. I am the substance use disorder professional at Washington State's only public recovery high school for young people in recovery from substance use disorder. Yeah. I'm excited about this. You know, for too long, we've been like this hidden gem that actually is located right up about 5 blocks away from here in the old Queen Anne High School gymnasium. This has been since 2015 through a partnership between Seattle Public Schools and King County Behavioral Health. We've cultivated a school that, if you want to know if it's working, well, let's just look at this month. For Gratitude Month, you're going to get to hear from one of them tonight, actually the one with the student with the most sobriety. But we've had 6 students, teenagers, celebrate annual milestones in recovery. Based on models that have worked throughout the country, this partnership between Interagency, Seattle Public Schools, and King County Behavioral Health has taken something and truly incredible, and I'm watching young people. Of course, it's amazing to have uninterrupted sobriety, but more importantly, I want to talk about the quality of the recovery, of transforming their lives. And the best way that I can do that is to have one of those young people themselves talk about this. Please reach out, please come visit. This is I've never seen, and I've never been so passionate about something my entire life. All I want to see, and I'll put my whole life's work into this, is getting another recovery high school in South Seattle in a more diverse area. I am just honored to be a part of it, and thank you all. There's so many people here that actually made the school possible. I don't want to take any more of Karis's time. Please join me in welcoming Karis.
My story started way too young. I think that most people And most youth that struggle with mental health, their story starts much younger than people know. I started showing symptoms young, but I started using at the age of 11 and continued that up until I was 15 with many suicide attempts, running away, basically doing anything I could to get my hands on drugs. I was using fentanyl, meth, like anything I could get my hands on. I was using. I ended up being administered to multiple hospitals like Fairfax and a couple of the others, and being sent out of county to kind of for just damage control. And that landed me in 2 rehabs. On my second rehab, I was sent to Muirwood in California, and I heard about interagency, and I got the opportunity to come try it out and test the waters. And by this point, I had started recovery. Like, I had gotten sober but wasn't recovering, and through the school I found out what recovery means, and automatically I was greeted with many youth that actually cared about being sober and strived for bettering themselves and everyone around them, and that was an environment that I wasn't used to. So it felt really good to have like adults and kids my age understand where I was at with a solution to help me recover from that. So I, between working the program of AA and like a lot of therapy and mental health work and support from Seth and all the other amazing staff at our school, I am now 2 years sober. Thank you. And honestly, it is such a blessing to still be alive. I think that everyone has the opioid crisis on the back of their mind and the mental health crisis on the back of their mind. And that is one of the reasons why I was so quick to say yes, was because it's the fact that I am alive today is defeating odds by thousands. And if we can begin to really incorporate a deeper look into every single youth and start providing them with services like the school, like Bridges, which is another recovery group, and outside of addiction, deeper mental health care and advocacy from people who know what it's like, because I think that is incredibly helpful, and I wouldn't have been able to get sober without other addicts. So basically, I think that the question that all of you guys should take from this is, how do we save lives, and where does this end? And it ends with other addicts. So thank you.
Thank you, Karis. Thank you, Seth. Treatment works and recovery rocks. Our next speaker is Susan McLaughlin. Susan, I had an opportunity to chat with just a few minutes ago before everyone took the stage. She's a licensed clinical psychologist with more than 20 years' experience in healthcare, behavioral health, and social services. She's held roles as a clinician, researcher, and policy administrator. Susan joined DCHS as the director of King County's Behavioral Health and Recovery Division. She just joined in September. She's a newbie in her role. And in her role, she oversees behavioral health treatment for the region. Let's welcome Susan.
I'm thrilled to be back at King County in this role, and I'm especially excited to host our legislative forum in person. This is the first time in person since 2019, so that's very exciting. I also had to revise my talking points this morning, which is never a good thing at the last minute. But I needed to acknowledge that yesterday we lost a great champion for mental health, Mrs. Rosalind Carter. Rosalind Carter was an early advocate for reducing stigma around mental illness, and in her speeches, she often framed mental health care as a basic human right, something that I wholeheartedly believe. She advocated for parity and other medical issues, was instrumental in the 1980 signing of the Mental Health Systems Act, and helped start the effort in this country to modernize mental health care. We're gonna miss her. Despite her best efforts, currently the behavioral health system is at a tipping point. And let's face it, the doors to treatment have not always been open to everyone. Decades of intergenerational trauma, a lack of culturally responsive healthcare, systemic racism, and discriminatory policies like the war on drugs have all led to disproportionate rates of Black and American Indian Alaska Native people experiencing homelessness, interacting with the criminal legal system, and facing barriers to behavioral health treatment. At King County, we envision a behavioral health system that is connected, accessible, and culturally responsive, and also can meet the growing need for care. For decades, mental health and substance use treatment have been neglected and grossly underfunded, but today I believe that we are in a moment, and this is part of why I took this job. People are finally paying attention, recognizing that you can't have health without mental health. New resources are being made available, and it is up to all of us in this room to use this moment to advance our behavioral health system in Washington and King County, and to not accept status quo. And you know what? Thank you. We know what it looks like to do better, to meet a crisis head on. In the face of a worldwide pandemic, King County was first in the nation to respond with speed, with science, and at scale. And that is exactly what it will take to respond to the crisis in our behavioral health system. The stakes are high. Thank you. In 2023 alone, 986 people have died from an opioid overdose in King County. Suicide is the second leading cause of death among youth nationwide, and too many people across the state are waiting far too long in jail to be evaluated for their behavioral health conditions, or they're waiting in hospitals and emergency rooms for treatment beds to become available. The workforce vacancies are double what they were in 2019 for behavioral health care. A recent survey we conducted in King County of our community behavioral health agencies found that there were 600 treatment provider vacancies in our region. 600. And you know what? It takes people to treat people. Thank you. Despite these challenges and the inadequate pay, our behavioral health workers continue to do amazing work every day. If you are a direct service provider in here, please give them a round of applause. They are heroic. What is clear to me is that there is great need right now. Treatment does work, and we need a whole lot more of it to support pathways to recovery. King County's Behavioral Health and Recovery Division is the main driver for a continuum of services ranging from preventative care and outpatient treatment to specialty team-based care, residential treatment, and crisis response. Today, King County contracts with over 40 community behavioral health providers that make up the King County Integrated Care Network. This integrated care network is a unique, first-of-its-kind partnership between the county and providers. Through this dynamic collaboration and a blend of federal, state, and local resources, the network works to ensure that a continuum of high-quality, culturally responsive behavioral health care is available to all. King County also provides much-needed support, training, and technical assistance to the network to help maintain the continuum of care that we have. Because no matter who you are or what insurance you have, you should be able to get the treatment where and when you need it. Yes, that's right, you should. The county and state partner very closely to provide the regional system of behavioral health care, and that partnership continues to be a critical foundation for success. So this year I have the privilege to talk about our robust legislative agenda. So I'm going to dive right in. And if you happen to pick up one of these documents on your way in or scanned the QR code, you can follow along that way, but you don't have to. I'm going to tell you what our agenda is. So first, we need to make Medicaid work better and strengthen our behavioral health workforce. Many people don't know this, but community behavioral health agencies in King County receive about 80% of their revenue from services delivered to Medicaid clients. That means that the stability and accessibility of our network is primarily determined by whether the Medicaid rates set by our legislature make it possible to operate an agency and pay appropriate wages. This summer, thanks to more robust Medicaid funding, King County invested $30 million in our provider network to strengthen our providers and raise worker wages. One example of the immediate impact was that one of the agency's Valley Cities is in the process of reopening a 24/7 withdrawal management service. This is what is possible. Thank you. Yeah, we need it. This is what is possible when we all work together. But it does take more than one-time adjustments. King County is calling on the state and the Healthcare Authority to change Medicaid behavioral health rates to better match the true costs and the full need for quality care. We also need to continue to support our workforce and ensure that more people can enter and develop careers in the field of behavioral health. To this end, we are asking for student loan support. When people have to take on debt to access education and get the credentials they need to work, it creates barriers, and it disproportionately keeps Black, Indigenous, people of color, and people from underrepresented communities out of the workforce. This year, we are calling on the state to expand eligibility, funding, and flexibility for state-funded behavioral health student loan support through the Washington Health Corps' Behavioral Health Program. This will benefit workers in community behavioral health across all of Washington state. Next, and you heard this a minute ago, we must respond to the overdose crisis. We know medications like buprenorphine, methadone, and naloxone work, but we need more low-barrier access to these medications. I am proud to say we now have 12 locations in King County where individuals have walk-in access to start buprenorphine, 7 locations where people have access to methadone medication, and 2 publicly funded mobile methadone treatment vans where people can access a range of wraparound services and community resource referrals. It's innovations like this that bring care to people. However, the rising overdose deaths indicate that we must do more. So we're calling on the state to require Medicaid contracts to support medications for opioid use disorder at all community behavioral health agencies, and also to support more providers to implement it. We're calling on the state to expand mobile vans that bring low barrier access to medication to people in multiple locations, particularly in communities with the greatest need. And finally, we must create easy access to life-saving overdose referral medication. Naloxone vending machines and other distribution methods can have a big impact. Third, we need to care for people in crisis. We must do more to prevent criminal legal involvement for people with behavioral health conditions. And it's time to fully resource both our crisis and commitment system and our crisis-based diversion. The state must sufficiently invest in services to keep people experiencing behavioral health conditions out of jails and to provide timely access to evaluation and competency restoration services for those who do encounter the criminal legal system. It's also past time to eliminate a decades-long pattern of state underfunding of crisis care. The state must fully fund all the services that it requires the local behavioral health administrative service organizations to provide. This includes things like responding to people in crisis, the involuntary treatment court costs, and access to care for people without Medicaid coverage. Right now, the local agencies and counties are left to either pay for those state mandates locally or cut back on the services that they provide. Finally, we must expand and preserve behavioral health facilities. As the executive said in the video, effective community behavioral health systems depend on places for people to go when they need more intensive services. It is imperative that the state continue and expand their investments to establish and preserve behavioral health facilities, including fully funding capital construction needs and addressing areas where there are missing services, like treatment for substance use disorders. So I want to echo Executive Constantine's gratitude to our legislators for stepping up in recent legislative sessions to invest significantly in behavioral health care. Yes. These are major steps in the right direction, and I thank you all for your leadership. I couldn't be more proud to be here alongside all of you tonight, and I look forward to partnering with you to increase access to behavioral health care and to support the people doing this important work. SAMHSA defines recovery as a process of change through which individuals improve their health and wellness, live self-directed lives, and strive to reach their full potential. I read that when Rosalind Carter was asked how she wanted to be remembered, she responded by saying, "I would like for people to think I took advantage of the opportunities I had and did the best I could. Let us together take advantage of the opportunities we have and ensure recovery for all." Thank you so much.
Susan, you are the right person at the right time for the right reasons. And thank you for being here tonight. And thank you so much for remembering Rosalind Carter, a true pioneer in our field. Right now, I'd like to introduce our next recovery speaker, because recovery is living proof. I'd like you to meet Aunte Damper. Come on up, Aunte.
Last December, my dear friend Besa, host of Rewind with Besa that you can see on Converge Media / Fox 13, asked me, what was I most proud of my work that I've done over the past year? The answer was simple. My pathway to recovery was the best gift that I could give myself. Yeah. But it wasn't always like that, y'all. In 2020, myself as well as others, right, was impacted by the pandemic and racial injustice. I continued to outreach to my community in the day, and then at night, I would confine myself in isolation, where in that moment, I was not living my best life. I myself was a meth injection user, and I would find myself advocating and protecting and building. And at night, I did not know how to give that to myself. The routine continued, the relapses, the psychoses came far too often. And then in 2022, it just got to the point where I had enough of not feeling enough. I actually wanted to end it. No matter how hard I worked, helped, loved, I just felt empty. There was a void inside myself that I struggled to feel. My friends were extremely supportive, but I wasn't ready to take care of myself. I just continued to take care of everyone else, not realizing I was putting myself in a deeper hole. I often thought to myself that if I actually got help, I would lose everything. Community support, jobs, family, partners. If I could not expose myself like that. So I hid those parts of myself and kept them in dark corners so no one can see but myself. One night, I looked in the mirror and I did not recognize me. I didn't know the man looking back at me. It frightened me. While looking at this image, it bared the resemblance of me. Hold on. It bared the resemblance of me. I thought about my community members that have lost their life to drugs and HIV. I thought of the ones that went through clinical trials, AZT, racism, homophobia, transphobia, mass incarceration, and lack of access to care and or treatment. In that moment, I realized that I needed to learn how to not be ungrateful and heartless It was time to take care of me. I had to take care of myself. My life depended on it. My time in treatment was a tough journey. Admitting that you're powerless over your ability, admitting that you're powerless over your ability to use was just of mind-altering substances was hell. Checking in with my friends was a must at this point. And by the time I left Lakeside Milam, I did some outpatient treatment. And at this time, I am a year sober. Thank you. Oh, Gramai's here. Come on up here, brother. This is my high school friend. Come up here. Give it up for Councilmember Gramai. Because I'm gonna make a point when I say this. Thank you. You know, I'm mindful to my capacity. I check in with my friends. And when it comes to burnout, everything that I thought that I would lose is still here. Everything that I thought that I would lose is here and then some. I'm so thankful to be the community organizer for Voices of Community Activists and Leaders, also known as Vocal Washington, where we seek to bring political, give it up for the organization. It's an affiliate of Vocal New York where we seek to bring political power to community members that have been impacted by HIV, substance use, mass incarceration, homelessness, and the war on drugs. And yes, the war on drugs. Can we clap for that? Because it's still happening. I'm so thankful to serve as the vice president of the Therapy Fund Foundation, a nonprofit organization devoted towards eliminating barriers to Black healing with providing outreach and peer support to Black community members to have access to a Black licensed therapist in this state and in California. I'm also a part of the leadership team for Brothers United in Leadership Development, an organization that advocates and empowers Black men in this community, not through grants, but through love and appreciation to the Black men in this community. And I also want to shout out Converge Media. I also host a show on there called We Live in Color, where I highlight Black LGBTQ community members in this city. We will not be tokenized. You will hear our stories. And I stand here now and I smile. This year has been amazing for me. I will continue to tell my story. And when I think about my community, when I continue to tell my story, I think about my community members in South King County. Shout out Representative Claire, who can't get the same access to care as I did myself. That's why I'm very excited about this new behavioral health levy that we've all just approved. It's a great opportunity to make sure that we are providing access to care to our community members. And when I think about this levy, South King County has been yelling about this for years. Not a second, but for years to get this access. So as we are rolling this out, I just can't wait to be a part of the team, to continue to be that community compass, to push this levy. I'm so thankful for this opportunity, and I pray that we can bring awareness to community members that have been impacted. We all have a part to play in this community. When someone is impacted, or in crisis, or in psychosis, what part will you be? How will you stand in this community? Thank you very much.
Ladies and gentlemen, the bright side of addiction is recovery. Aunte embodies that. Thank you, Aunte. Thank you. Thank you for sharing your inspirational journey of recovery with us. Next, we're going to hear from Michelle McDaniel. Now, she's the CEO of Crisis Connections. Now, Michelle is a lifelong King County resident who's dedicated over 30 years to her career in behavioral health. Crisis Connections, if you're not familiar with it, you should be, provides free, compassionate help 24/7. accessing and navigating the behavioral health system throughout Washington State through programs like Washington Teen Link Helpline, King County 211, and serving those with a King County area code through the 988 Crisis and Suicide Lifeline. She's an amazing woman. Please welcome Michelle McDaniel to the stage.
Thank you all for being here. And then you heard in the introduction a little bit about Crisis Connections. Again, we've been around since 1964. We specialize in serving folks through our helplines, 988, regional crisis lines. Our helplines serve as one of the primary connectors to mental health care and substance use treatment in King County and actually across Washington State. Because of my role, I see firsthand the need for treatment and services. People are struggling more than ever to cope. We see this in the nearly doubling of calls, texts, and chats that come to our helpline since early 2020. Not only are we receiving more calls for help, but clients are in more acute distress and are dealing with multiple and more complex challenges. Our adult and youth clients report higher levels of suicidality, more intense symptoms of depression, anxiety, greater levels of substance abuse. More callers report financial instability, fear of losing their housing, and increased struggle to keep up with the rising costs. These challenges are significant. That being said, this is the most exciting time it has ever been to be a behavioral health leader in this community. We've talked about a lot of the wins already. The passing of the King County Crisis Care Center levy is going to build these walk-in clinics, invest in residential services, invest in our workforce. Thanks to the dedicated funding through a Washington cell phone tax in July of 2022, we successfully launched the 988 Suicide and Crisis Lifeline. Thank you to Senator Dhingra and Representative Orwell. I don't know how much you're aware, particularly of Senator Dhingra and Representative Orwell, of the champion work they've been doing, particularly in the last few years, toward not only funding the 988 system in Washington State, but behavioral health reform in general. So thank you. Other wins, other exciting things are happening. We are partnering, Crisis Connections is partnering with diverse people within the behavioral health system toward law enforcement response diversion. Really, absolutely critical. So we are well into planning that in 2024, we will be embedding 988 clinicians at 2 911 centers in King County. So again, we can divert. Thanks to the work of the Raising Wages for Changing Lives campaign, for which I'm very proud to have launched and co-chaired with the Seattle Human Services Coalition, the Seattle City Council passed a pay equity resolution for human service workers, another huge win. And thanks to efforts led by a coalition representing community behavioral health providers, workers, and regional governments, state legislators passed a 15%, unprecedented 15% Medicaid rate increase effective this January. And the last win I want to highlight is this summer, the King County also made significant investments of $30 million in partnership with the 5 managed care organizations, as we heard before. And this was resulting in 15% Medicaid rate increases for behavioral providers. And I will let you know that because of all these wins, I want to let you know that this September, I was able to provide a 27% wage increase to our frontline workers. That's the impact of these wins. So as I shared earlier at Crisis Connections, we see firsthand the urgent need to invest in long neglected mental health and addiction treatment services. As the front door to the crisis system, our staff assess the situation and request critical behavioral health services for a caller, whether it's a visit from a mobile crisis team, whether it's the next day appointments from clinicians. Yeah, crisis team, let's shout out the mobile crisis team. a next day appointment with a clinician in their community, or other services supported by the crisis care continuum. But those resources are either stretched thin or are not available at all. Therefore, the crisis deepens. In our community, we could not imagine a situation where immediate and skilled care simply was not available when someone has a physical health crisis. How would our community react if it took 6 or 8 hours for an EMT to arrive on scene to care for a heart attack or stroke victim? But that equivalent happens every single day when a person is experiencing a mental health crisis. So, I have a question for any providers out there. Are any of you having difficulty attracting, retaining staff? Is it just me? New investments in the crisis system are exciting. We've talked about the walk-in crisis centers, expansion of multiple crisis team and DCR teams. We've talked about the additional residential beds, co-responder teams. But here's the challenge. We have a workforce under immense strain and too many vacancies throughout the system. Investing in all this is amazing. We need to have the people to do the work. A robust, representative, and well-supported workforce is critical to providing quality, equitable behavioral health care. I believe the pathway to building this diverse and representative workforce has 2 things. 1, funding organizations such that they can pay equitable wages that truly reflect the difficulty and value of the work that our staff are doing. Second, reduce the financial barriers for people that enter the behavioral health field. The last challenge for us to work together to solve is the need to expand access to recovery services and life-saving care to stop the opioid overdose crisis. You all understand the magnitude of this issue. Despite the scale of the magnitude and the growth of this crisis, our Washington Recovery Helpline, a crisis connections program that connects people to withdrawal management and recovery services across Washington State, we've had to drop our helpline hours due to being short-staffed, and loss of state funding. Dropping the hours of the Washington State Recovery Helpline is the last thing we should be doing right now. We've got to turn this around. And I have one more idea I'd like to offer to help not only turn these challenges around, but also allow providers to invest in the data collection and analysis tools to better understand the gaps and the opportunities. We've got to be able to assess the impact and have the data. Thank you for data. Shout out data. By investing in workers, facilities, and treatment, we can create the system that we all want to see. So here's my last big idea. Reform our tax system so that it is progressive and people and companies pay their fair share. So thank you again to our elected officials. You have all done amazing work, all of you. I shout out some special folks, but everyone on the stage, I thank you for everything you've done and for being here. And then I look forward to partnering with you all and my colleagues toward a more humane behavioral health system. So thank you.
You know, the personal stories of recovery are the part of the evening that I certainly look most forward to as we celebrate recovery. Recovery needs to be celebrated. Damn it, recover out loud, please. Next up, we have someone who is going to recover out loud, our final recovery speaker for the evening, sharing another personal story of experience, strength, and hope. Please welcome to the stage Marjorie Drieu.
My name is Marjorie Drieu. I use she, her pronouns. And on May 6, 2019, I got arrested on felony drug charges and taken to King County Jail. I told them I was in active addiction and would go into opioid withdrawal. They drug tested me to verify, and the nurse came back and told me I was pregnant. My recovery date is May 7th, 2019. Thank you. I was put on methadone to protect my baby, and for the first time, the detox in jail was bearable, a very different experience than the 16 other times I'd been arrested. I got my first court date, and thankfully was assigned to drug court. One felony was later dismissed due to the Blake decision, and I didn't realize the implications of that because felonies aren't important when you're sticking a needle in your arm every day. Although I've lived in the US since I was 10, I'm a French citizen, and a conviction likely would have resulted in deportation. For 10 years, until I was 17, I was a competitive gymnast. My senior year, my doctor found 2 chronic stress fractures in my lower back, which ended my athletic career and just about broke me. I had too much time on my hands and nothing to fill it with. 6 months after graduation, I smoked heroin for the first time. At the time, I had a job and a car, but within a few months, both were gone. My addiction was in full force, and 2 years later, I shot up for the first time. Things went downhill fast, and for the next 6 years, I engaged in criminal activity ranging from petty shoplifting, trespassing, to eventually selling drugs to support my habit. When my family found out I was using heroin and meth, it was very hard on them. My dad found a way to distance himself from my addiction, but it made my mother physically and mentally ill. Countless nights she drove around looking for me on the streets, not knowing if I was alive or dead. She would call my phone many, many times, but talking to her interfered with getting high, so I ignored her calls. Not once did I stop to think about the mental toll my addiction had on my family. On Christmas Eve 2015, I showed up at my parents' house with a puppy. I said this will help me get sober because I'll have to take him out and feed him. My thinking was so warped, I believed those words. Yet I just bought a puppy with no bed, no food, and no plan. Later on, my mom stopped by the drug house where I was staying, took one look around, and she took my dog. I couldn't hold down a job. My license was suspended. I was living unsheltered and banned from most motels. I had alienated my family and was surrounded by people living just like me. When I called my mom to tell her I was in jail and pregnant, she thought this was the dog story all over again. And her first reaction was, "You can't have this baby." How could she not think that and be afraid that she'd have to raise my child? I said the same things. I'll be responsible. I'll stop using drugs. Except this time, that is what happened. Thank you. My son, Liam, saved my life, and drug court gave me my life back. In drug court, I worked with a release planner and my amazing case manager, Lizzie DeShane, who clearly had my best interests at heart. Drug court set a plan, and I gave it a chance. I was in jail for a month, then released to Swedish Ballard's pregnant, they have an inpatient program for pregnant women. At my court hearings, the judge, Judge Lum, he humanized me. I had the structure of weekly court dates and an intensive outpatient program at Therapeutic Health Services. And for the first time, I felt like I had a voice. My successes were celebrated, and it made me want to continue on that path. I had the structure needed to rebuild my life and the right people to guide me through it. After graduating from drug court, I became a peer services specialist, working with the same drug court that had done so much to help me succeed. Working side by side with Lizzie was an absolute dream come true. My addiction, which had been so shameful previously, was now a vehicle to help others, and it gave me a purpose. I was promoted to program manager at Peer Kent about a year later, and in my role there, I oversee justice contracts with King County Drug Diversion Court and South King County Municipal Courts. In the 4.5 years since I began my recovery journey, I bought a car, got my first promotion, opened a bank account. I'm employable. I'm a good mother, daughter, sister, and friend. I have a relationship with my family again, but best of all, I have myself back. My son just turned 4 last Monday. And he gets to grow up with a present mother. He never has to see me loaded, and that's something I could never have achieved without all the support that I received. I get to help people by using my lived experience of addiction and recovery, and today I have a voice. I'm a woman of integrity, and today I live a life that I don't want or need to escape from. Thank you.
Now our legislators are going to get a chance to respond to what they've heard here tonight. Legislators, we'd like to welcome your comments. Please take about a minute each. We'd particularly be interested to hear your thoughts about what you've heard tonight during the program, or perhaps earlier during the roundtable discussions. Your priorities around mental health are of concern, and substance use recovery for 2024. And I would like to begin with Lauren.
You know, it's fairly difficult for me to be here tonight because the reason my feet are planted here, my best friend Ricky, who shared his recovery story at this forum in 2014, the following year in 2015, the county prioritized Ricky's law as a legislative priority. He was subsequently the photographer at this event every year. And Ricky died in May. And this is a man whose husband is a doctor and best friend is a legislator. And our system failed him too. And so I'm just here tonight so acutely and intimately aware, more than I ever have been, of how pressing the needs are. And at the same time, you know, Ricky's the one who taught me to believe in miracles, and I heard a few miracles walk up here tonight on this stage, and I still very much believe in miracles and very much believe that recovery is possible for all, and I'm working on some legislation to that effect for the upcoming session. Thank you.
Thank you very much.
Thank you, everyone, for sharing your stories. They are what makes this work possible. And I'll just start off by saying that stigma is 100% curable. And it takes each and every one of us to work towards ending that stigma every single day. So thank you for sharing the stories, because that's what helps. We have to make sure, yes, you can clap, go ahead. We have to make sure we talk about mental health, substance use disorder, the same way we talk about cholesterol. And until we get there, we're always going to be behind. For the legislative session, I'll say I'm going to continue the work around 988 and building out that crisis system. There's some great recommendations coming out of the CRIS committee, and so I'm very grateful for the work that everyone has been doing in working to make sure our crisis system is better. And when we improve our crisis system, it means we have to improve all our preventative care as well to make sure we no longer need a crisis system. And a huge priority is going to be workforce. Workforce. So thank you for your engagement, and we look forward to seeing so many of you during the legislative session, reminding us all about the behavioral health priorities for next year. Thank you.
There's so much that needs to be done. There's some things that we have done, and there are things that you will see us doing. And I would say, first of all, I would say hello from Representative Lisa Callan, who couldn't be here tonight, but right now is co-chairing our Children and Youth Behavioral Health Care Work Group, which I'm part of. And if we think about this coming session, one of the things you'll see is the prenatal to 25 behavioral health strategic plan recommendations that have been happening. The meetings have been happening throughout since session, and you will see a set of recommendations that cover that full gamut. So as we're talking about individuals who are pregnant all the way through individuals in our system, young people as well as adults. And as we think about SUD and OUD treatment in particular, I have a focus on intersectionality, individuals that are in our systems of incarceration, and also in particular our LGBTQ community, and making sure we have access, opportunity, ownership, and voice for all of those folks who need support. Looking forward to working with you this session.
Thank you.
Well, thank you all for being here tonight. And for those who shared your stories, really deep gratitude. And I think it drives home the lesson that we need to have those with lived experience at the table. That helps us make better informed policy. And as I said tonight at the table for our discussion, I don't know anyone in my circle that hasn't either struggled with a mental health issue or has someone they love who struggled with a mental health issue. And I have to say tonight, I've been thinking very much about my nephew who lost his struggle this last May. And that actually came as a surprise to a lot of us. And I think we need to understand that sometimes the symptoms or you're not going to see it necessarily happening in someone's life. And so it's important to be there and to let people know, and the stigmatization, I think, is real. And we need to be able to deal with that. We need to end that. As I said tonight, it's mind, body, spirit, and it's really important that we remember that when we are looking at our overall health. So just know that I'm there as a resource and there as someone who wants to roll up my sleeves and help make this situation better for everyone. Thank you.
You know, this year's been really hard coming out of COVID, which was incredibly challenging for many of us. I've been really quite down this year about the number of people I know who've died and who are struggling. And I just want to say I look forward to this event every year. We haven't been able to come together for the last few years, and as expected, I am here tonight feeling hopeful and inspired, and very thankful to Seth and Karis and Aunte and Marjorie for your stories, to the many others of you who have shared your stories with me and the folks up here and others. You are what makes our work possible. For those of you who know me, you know that I will be fighting hard to make sure that people have the access to the care that they deserve and that they need and that we need for our communities. So I'm not giving up. Hopefully, if you don't know me, you'll get to know me and reach out to me, because we need to work on this together. We owe it to each other and we owe it to our community. And I look forward to the work we're going to accomplish in the 24 session.
Some of you may know I've been in long-term recovery myself, and you know when I hear these stories, it just fills me with hope. You know, I think it comes down to love. You know, the love that these people have, that we have for each other, and you know, we get to live lives beyond. You know, I always say beyond my mom's wildest dreams. So I am just so grateful for the stories of hope and love that we heard tonight. You know, one of the things I really have been working on since I got to the legislature is along the lines of behavioral health, and that's a different disorder. It's gambling disorder, problem gambling, gambling addiction. So, you know, the legislature, we were able to double funding for treatment of problem gambling in the state this last session. And I'm looking forward to introducing a bill next session to create another therapeutic court. It'll be a gambling court to help people get treatment instead of prison. Because as many of you, well, some of you might know, gambling is the #1 activity in prison. So, you know, really not the place to send people with a gambling disorder. I'm just so grateful for you all being here and just incredible stories I've heard. So thank you.
20 years ago, I was appointed to what at the time was called the King County Substance Abuse Administrative Board. And a couple of years later, we formed a legislative committee and decided to hold a forum, a legislative forum. So I actually got this started 20 years ago. But wait, Neil and I have been working together for years, but nobody showed up. And I just wanted to follow up on Senator Dhingra's comment that stigma is curable. You have showed up. And we did a lot of hard work 15 years ago to try to get these, you know, not many people would show up, but you are showing up, not just here, but you're showing up for those you love, showing up for those who really need help, and I really want to thank you.
Echoing all the comments to thank those who shared their stories, both here at the podium and also at the tables. You can think of me for sure as an ally fighting for behavioral health care that's accessible and available for all people. I also want to acknowledge that at our table, we had many folks who are working in the behavioral health care field, and I want to thank you and say back to you that I hear that you're overworked and underpaid, and that's a systemic failure, and we'll continue to fight for family-sustaining jobs for all of you and for others out there. And lastly, I'd say that I think an important part of our role as legislators, or certainly my role, is to be an ambassador to the community, to welcome in crisis care facilities and other treatment services in our districts, and I'll be there standing to make sure that we have culturally relevant and available care in our communities.
Just wanting to thank everybody for putting this together tonight and for your time, and for the wonderful conversations at the table, and just really showing the humanity to the amount of care that we all have for supporting the most vulnerable. And I think I'm part of a pretty good team up here, and I know we're all part of a good community. We're going to tear down every barrier until every person has the resources they need, and they have the ability to live life with dignity without shame. So thank you again.
Thank you again for allowing us to be here. And I'll try to help demystify the legislative process a little bit, but I know that oftentimes it can be kind of confusing and mysterious, but at the end of the day, it's really about showing up and caring. And the fact that you're here on a Monday night, the week before Thanksgiving, shows that you care, shows how important this is to the community. And we take that with great pride, with great humility, in the sense that we want to bring those stories back to the legislature to really support and uplift the work that you're doing. So I just want to say thank you.
In this space in particular, I wanted to thank Karis for sharing her story and for really raising the issue that a lot of her mental health struggles started when she was younger. And that is the angle that I have continued to hammer in the legislature, that we need to work on these issues, not just for adults, but for children, including starting in childcare, starting in K-12 schools, and making sure that we are recognizing and getting kids both the social emotional learning that they need, but also recognizing early interventions and doing the work then. And it's great to be able to partner with my seatmate on many of those issues in the K-12 system in particular. As Senator Wilson mentioned, our colleague, Representative Callan, is working on a children's mental health strategic plan, and I'm looking forward to incorporating that into our state's overall behavioral health strategic plan that we are working on. It'll be a 5-year plan, which is due in about 2 years. I'm honored to be co-chairing that, and look forward to really be focusing on prevention as the #1 aspect of that, and of course going all the way through everybody's needs, behavioral health, SUD, you name it. So thank you guys for being here and really continuing to help put the human face to and the stories to the work that we do. Sometimes when we're looking at pieces of legislation, it can be kind of dry, but when we keep your stories and your faces in our hearts and minds, that makes it a reality, and that makes us come back down to really focus and ensure that we're doing the work and getting it right for you. Thank you.
Really adding to all that my colleagues have been shared, I wanted to thank you for elevating the important work on reforming our regressive tax system. Yes, more than that. I need more than that so we can pass wealth tax. Seriously, more than that. I need us to really talk about wealth tax every single time you visit Olympia, every single time you talk to your legislators. I don't care if your legislator is a Democrat or Republican, because our needs, the services that our people need, required the kind of revenue that is ample. And we can, and we have, and we will, because of your work, because of your help. So that is and will continue to be my focus on the work to ensure there's revenue stream to provide these services. But the area that I'm really focusing on, and Representative Sands mentioned it, is around the K-12, mental behavioral health, and specifically in our special education. Is critically important because public education is important, and the beauty of public education is that it provides that particular services to every single child in our state, and we heard repeatedly from those who share their experience, it's from school. And school is where our children spend so much time in, and that is where they learned how to socialize and interact with others, and that is where they learned how to build their networking. And we do not survive, we do not strive alone. We be better, we progress better, we hope better together. And so because of that, we need to build that community that allowed the togetherness. So thank you for your support.
I really appreciate the sharing of the stories that were then reinforced tonight for the whole group of if someone has, at the moment in time, someone has the courage to call the crisis line, to call or ask for help, our duty, our moral obligation as a society and as legislators is to make sure that the help is there. Not just someone pick up the phone, but that the services are there and they are available that day, not weeks later. And we have so much more to do. Thank you.
Hi everyone, Daria Farivar here, also in the 46. There's so much I could say right now, and I guess what I'll focus on is what I heard crystal clear tonight are your powerful, powerful stories. And I want to promise to you all that I am working hard to institutionalize hearing from folks with direct lived experience on these tough, tough issues. And I thank you for your courage in stepping up and sharing these stories with us tonight. The other thing I really heard was that we need more support on both ends of the criminal legal system. We have to create relief valves up front to get folks diverted into the treatment that they need instead of cycling people through incarceration and deep, deep crisis. We need to also, on the back end of the system, make sure we're releasing folks into successful situations. We're working on legislation to make sure that every single person released from a state hospital and from our correction system have an ID to go into the community to get connected to the services they need. Lastly, I want to talk a little bit about the diversion programs on the front end and emphasize how important it is that we fully fund those things like mobile crisis, like co-responder programs that are getting to people, as my seatmate said, as soon as they need help. We need more programs like this, and we have to make sure that those are consistently funded. We secured funding last year for both Link and LEAD, and I'm proud of the work we did there, and we're going to do it again this year. Thank you.
I really loved hearing the courage, strength, and hope up here tonight. I love people in recovery, and I love people working on their behavioral health stuff because you're doing the work. I trust you more than normies, I really do. You know, like you're doing the work, right? You're doing it, so thank you, thank you. You know, we're working so hard to get these centers sited somewhere in our cities, and we need your advocacy. Director Fleur will join me in saying we need your advocacy to talk to your mayors about siting these residential centers and behavioral health crisis care centers in our cities. We need people to say, yes, here, please, because it's not other people, it's our loved ones, it's our friends, it's our family, right? And we need to take care of them. So if you want to work on this, reach out to me at King County. I would love to work with you. We need that energy. Step up. Let's encourage our people to have a blip in their life rather than a catastrophe by having the right care for them at the right time. Thank you.
Great pleasure to be back in person. I look forward to this event because I know every year coming here that the stories I'm going to hear of recovery, they are energizing and they are motivating, and we all carry them with us as we head back to Olympia and do the work that you're here asking us to do. For all of you who work in recovery, in substance use treatment, in behavioral health, I know how hard that work is, and I just want you to know that we are all here because we appreciate you and we appreciate the incredibly hard work that you do every day. And I know that there may be moments in the day when you wonder if people know about that critical work, and I'm just here to say we do, and we thank you profusely. It is so important, and it's really validating to hear about the ways in which the additional Medicaid rates for behavioral health that the legislature was able to fund this year have resulted for many behavioral health workers seeing wage increases and seeing expansion in the kinds of care that's available to people in King County. And speaking of people who are overworked and deserve to be paid more, I just want to acknowledge that there's nobody that I know of worked harder for the behavioral health rate increases than my colleagues Nicole Macri and Mia Gregerson, and I just want to thank them publicly for working so hard to make sure that that happened this year, and I know that they're going to keep working at it, as are all of us in the years to come.
Thank you for your stories, because I know one thing for certain: one person's story is going to help the next person. And the stories need to be told, and I thank you for the words I didn't hear before, but love it. Recover out loud. Keep that going. We need to have those loud and clear, because one day I really hope that behavioral health care is just health care. And that's going to be a part of it. And I'm so proud of King County for having voted in our levy this year that's going to expand services. That's most important. People stepped up and said, we need this. And that's our community saying together, acknowledging that. And that's really important. And all these steps we take along the way. And 988, you know, I just mentioned to someone today, do you know about 988? You can call it anytime you need it. Call it, please, use it. We got it going. It is for you. So please, spread the word, keep recovering out loud, and thank you.
I want to thank you for the stories tonight. As Joe mentioned, they're very inspiring and motivating to us, so thank you for that. But working together, we are actually making progress. Let me give you 5 examples. Maybe that's the best way to end this evening, is 5 success stories, shall we say. First one is that the University of Washington is going to be opening up a new behavioral teaching hospital, a teaching and treatment hospital up at Northwest Hospital with 150 new beds, and that'll not only care for people, but train the next generation of workers in behavioral health. Number 2, there's a new behavioral health institute at Harborview, and we are raising efforts with the county to fully fund the construction of that building and also provide services to also develop workforce. Third, Apple Health and Homes. Last year we passed Apple Health and Homes, which is to basically have a prescription for a home. And the basic thought is if you are chronically homeless and you have a medical condition, substance use disorder, mental health issue, or a significant physical disability, then you should have a home as part of your medical treatment. This is extremely important, and not only that, but we had a major advancement just a few months ago. We were able, through the State Healthcare Authority, to convince the federal Medicaid system to start providing Medicaid matching funds for the actual homes. So we need to build on that, because that's an incredibly important thing for the future. Fourth, I'm putting together a proposal for recovery residences for getting funding out of the State Housing Trust Fund. My assistant, Angela Langer, is here tonight. She's helping us, so please contact my office, Angela Langer, if you want to participate in the effort to basically ask for about $25 million for funding, capital funding, for actually acquiring recovery residences. Fifth, I don't think you've asked for enough, okay? The workforce proposals you have is actually really good, and I think everybody's involved in that. Well, we ought to go much further than that. In 2019, we passed the Workforce Education Investment Act. We raised taxes on business in order to fund free college and university tuition for all low-income students, but only for undergraduate and only for low-income people. What we ought to do is expand that, so no matter what your income is, we will pay free tuition from the state for undergraduate and graduate level degrees to fill essential jobs in behavioral health, early learning, child development, etc. This is a huge opportunity because we need to plan for the future. So ask for more.
I'd like to end with kind of a challenge to you folks. I appreciate you being here tonight, and hopefully you will be here next year for the Legislative Forum. And I would challenge you to bring one of your colleagues from Olympia with you, someone who obviously is not here tonight, that needs to know, that needs to hear, that needs to do. That's your challenge going forth. So I thank you, legislators and other elected officials. And I want to give a shout out to Patty Murray and her staff. She wanted to be here tonight, but obviously that was not possible. From a federal level, boy, she is connected, and she is concerned, and she is compassionate. I cover the Seattle Mariners with her brother Greg, and I know firsthand how committed that Patty Murray is. Other staff who are here, members that I want to recognize, Staff Representative Lisa Callan from District 5 and the staff for Senator Jamie Peterson, all of them here tonight. Could we give them all one more round of applause, please? And ladies and gentlemen, I encourage you to keep in touch with these legislators. They are your voice. They are our voice. They are people who will listen and who will react and act. We all face changes and choices and chances and challenges, but we're going forward, together, forever, backward, never. Thank you to all the legislative staff, our 41 co-sponsoring organizations, all the volunteers and staff helping us tonight, people in recovery from mental health and substance use. You rock. Celebrate your recovery. Thanks to the behavioral health providers, health and human service partners, and Christopher Archipole, and our Recovery Art Showcase artists. They did a great job. Our language interpreters and live captioner, our community members, all of you folks who came out tonight, and a giant thank you to Amanda and Kristen for coordinating tonight's special event. You guys did a terrific job. Thank you very much for joining us tonight. Always remember, the bright side of addiction is recovery, and recovery is living proof, as you have seen tonight. Stay healthy, live in gratitude, and be kind to others. Have a good night. Thank you so much.